Then we look at writing a research paper. So once you have, you've decided your research question, you've got your ethical structure and points in place, you've collected your data, and you've analyzed it, then you might want to come up to writing your research findings. So there is a relatively standard way of writing up your research. And broadly, there is some sort, when you come to write your research, there's some sort of introduction and background, where you sort of justify why you've done what you've done, and talk about why your area, your research topic is important to study, and why there's a gap in literature. You know, it's not only that it's important, but that no one has the answers to the questions you're asking. And then you look at, then you will talk about the methods. So this is, you know, this is not just how you collected data, but how you recruited people to your study, what you told them when you recruited them, the procedures you went through, what analysis you conducted, and what technique you used. It can also include things around the quality of the research, any translation that you did, how you did it, how you ensured that it was accurate, you know, the nitty-gritty of what you did. And then you'll present your results in some shape or form. Often visually is something that helps people understand. So that could be in terms of graphs or tables, or a conceptual diagram which shows relationships between themes. And then finally, there's a discussion section where you are interpreting your results, you're highlighting key findings, you're comparing with an existing literature. What are the surprising things that came out of my work? How does it differ to what's gone before? How does it build on what's gone before? And where do I think other people should focus on in the future? And there are lots of people who can support with this standard way of writing. So this is an image from a professor's Twitter account, and he posts a lot of things around how you can write scientific papers. So, you know, he's broken down the discussion into starting with a summary, then looking at how it builds on previous work, looking at the implications and recommendations of your work, and looking at future research. So you can see here a very, very detailed structure. And so that is something that you are, that's something to look at. There's plenty of resources out there. And hopefully, again, this lecture is introductory, and, you know, we can direct you to resources that will help you achieve what you'd like to achieve in terms of research. But there are other ways of writing. It doesn't have to be so standardized. So I run a journal called Stolen Tools, and we look at health inequalities in terms of racialized minorities. And we accept many different forms of writing. So you don't have to follow the structure. If you don't think it's the best one, you can be more creative in your writing. You can, you know, get support from a mentor to develop how you want to write as well. So this is a standard sort of representation of how research papers are written, but it's not the only way, and it doesn't have to be the only way that knowledge is shared. The final, before we go into some examples of research papers, final step, obviously, in the research process is to share your research and try and make a difference. So there are many, many different potential audiences, and what you share should be tailored to the particular audience you're looking at in terms of language, in terms of presentation. If it's a government sort of policy brief, then the policy recommendation should be up front. If it's an academic journal, then they'll be at the end once you've explained the background and the methods. If it's for a community audience and you want to have more understandable language, if it's for social media or other sorts of media, then you might want to be a bit more punchy and succinct and in the way you're writing. So, but thinking about how you want to share research is really important, because there's no point doing it if no one reads it, if no one listens to it, if it changes nothing. So sharing your research is vital, and there are lots of ways of doing it. And here, for instance, I've got I work with people from Afghanistan who were seeking sanctuary in the UK, and we had from that research we had a lot of recommendations for myself and the Afghan organizations I worked with on how mental health professionals should work with people seeking sanctuary from Afghanistan. And so we created like a guidance document. So that was, we thought, the most effective way of sharing the findings, not necessarily in an academic journal, but in a guidance document that can and has been shared throughout our national health system. So that's something to plan for when you're doing research. It should always be, you know, often it's a part of a research which is you know, not given enough time or resources, but it's probably the most important part of the research process. So yeah, those are some ideas. And I just wanted to finish by looking at three papers to look at the different sorts of research, thinking about the different ways they might impact. So this is a paper from Yunus and colleagues on the prevalence of obesity among healthcare workers in Gaza. So this is a quantitative study, and this is a key table from their quantitative study. You can click the link to find out more. But you know what they found, and this was obviously they did it in 2022, so and it published in 2023. So the situation will obviously change quite significantly now. But here, you know, you can look at, they were interested in the health of healthcare workers. That was really important for them. They were motivated to improve public health by supporting the people delivering it. And you can see here that they so this is taken from a regression analysis, and you can see that they've got differences in obesity based on gender. So here, men are more likely to be male healthcare workers are more likely to be obese than women. You've got an age difference in age. So those who are older, by the looks of it, yeah, are more likely to be obese. Similarly, those who are married versus unmarried. So, you know, this is an interesting, I guess, paper. It's a quantitative paper. It's trying to improve certain aspects of health services, and it's, I guess, I think it's got a clear. This is what I want to do with the findings. You know, it's got a clear impact. I think. Clear recommendations. It basically recommends support for certain groups of healthcare workers. And this is a qualitative study from William Hamuda. She's looking at the so by the way, you can look here in a quantitative study. They've surveyed and got health outcome information from 1,850 people. And then the qualitative study, they've spoken to 35 women about their breast cancer diagnosis. And so this is a very short summary of what they've done. It's from the as part of the journal's work, we also summarize papers so that people can digest them and read them more easily. But so this study worked with 35 women who had a breast cancer diagnosis, and it talked about like their initial shock about what happened, their guilt about potentially not being able to be a caregiver, and then it talked about some that supported people through it, for instance, social support. And then it looked at people's experience of social support and found that actually it wasn't quite as simple as everyone has a lot of people around them, or everyone else initial shock can can emotionally get through it. So it talked about that actually there are some gaps, and it tried to highlight the fact that it's not just about health outcomes; it's also about social, emotional well-being outcomes. It's not just about investing in medical treatment, but it's also investing in social treatment. So this is something that a qualitative study is going to find, and it's going to be able to look at beyond the numbers what is needed. And it's got a it's filled with a lot of powerful quotes from people. So if you're reading this and if you're sharing this research, there is something about qualitative research which it tells a story, and it can persuade people to change policies, to change. And again, a very clear outcome and recommendation came from this, but formal support for women's non-medical needs should be invested in. And then I end by sharing a paper I've done. So this is a review. So I'm using secondary data. So I'm taking all the research which was done previously around mental health issues in asylum seekers and refugees, and trying to combine them to see if there are patterns in what people have done before. So I took about 32 papers on this matter, and I tried to look at what are the factors affecting people's mental health when they're seeking asylum. And so this is one of my key findings. I had different areas in which people's mental health were affected. I guess this is an example of how new knowledge isn't simply about you doing primary research, talking to people, surveying people, and creating new knowledge for new data. It can be about taking what people have already done and synthesizing it and bringing it together and seeing the broad international patterns. One of these papers might have looked at access to traditional foods. Another one might have looked at unemployment. But when you bring it together, you see the pattern. You see, for instance, here, that the immigration system is really damaging people's mental health, that there are many, many points at which the immigration system makes people suffer unnecessarily. So yeah, that's another example. So hopefully you can see that how different forms of research might produce different types of answers. So this and might have different types of recommendations. So hopefully this has provided a very, very brief introductory summary into health research methods. It's hopefully given you some idea of the ethics involved, some idea of the methods, the data collection, the theories you might use, how you might analyze your data, how things might be written up and shared as well. But it's obviously there are all courses and degrees on particular elements of what we've just covered. So it's very introductory, but I would want to end by firstly thanking you, encouraging you guys to email me if you have any questions about research you're thinking of wanting to do.